So moving on to one of the new cardiovascular disorder, that is IHD. Now there are so many cardiovascular disorders, okay? So cardiovascular disorders are referred as CVD. So the most important cardiovascular disease is, we can tell it as CAD, that is coronary artery disease, which is also called as IHD, that is ischemic heart disease. Sometimes it is also called coronary atherosclerosis. We'll see it in detail, okay? Then some other cardiovascular disorders are there, like heart valve disorders, heart failure. We have got myocardial infarction, cardiomyopathy, or congenital heart diseases. Okay, so all these are cardiovascular disorders. So today we will see one of the disease, that is ischemic heart disease. So as I told, ischemic heart disease is also called as coronary artery disease, and sometimes it is called as coronary atherosclerosis, one of the most important disease condition. Okay. Now in coronary artery disease or IHD also, it is one of the major blood vessel disorder. Okay. It is one of the major blood vessel disorder where the blood vessel gets narrowed. Okay. This is a normal artery and this is a diseased condition with CAD. Okay, so here the blood vessel gets narrowed because of a deposition of fat or atheroma or plaque. Okay, this fat deposition is also called as atheroma or plaque. So when there is deposition of the fat, what happens is, or atheroma or plaque, there will be narrowing of the blood vessel. Okay, so when there is narrowing of the blood vessel, what will happen? There will be decreased oxygenation and decreased blood flow to the heart. Okay, so CAD is one of the most common heart disease. It is also called as ischemic heart disease, sometimes also called as coronary heart disease. Okay, so we already know that coronary arteries are the blood vessels that are supplying the oxygen to the myocardium, isn't it? And here what happens is, in coronary artery disease or coronary atherosclerosis, there will be deposition of fat or plaque in the artery, okay, inside the artery. Because of that, there will be narrowing. Okay, so because of the narrowing, what will happen? There will be decreased blood supply and decreased oxygenation. Okay, so along with that, patient will develop the chest pain, that is called as angina. Okay, and what happens is, the person will be having signs and symptoms like angina, many other symptoms will be there in the patient. Okay, and sometimes what happens is, the fatty streak that I told, or atheroma or plaque, which is a deposit of fat, may get dislodged anywhere in the blood vessel. Okay, it can get dislodged in anywhere in the blood vessel. That time it always results in myocardial infarction. Okay, that is your heart attack. Why myocardial infarction? Because this blood clot may get dislodged anywhere and it can stop the blood flow to any part of the heart. Okay, that time it will cause MI. Okay, so this is how all the complications are occurring because of the coronary artery disease or because of ischemic heart disease. So if IHD is asked, you have to write same thing what I am going to explain. Okay, because everything is the same. CAD, coronary heart disease, coronary artery disease, coronary atherosclerosis, and ischemic heart disease means the same. Okay, now as I told, coronary artery disease or coronary heart disease is a condition which affects the blood supply to the heart. Okay, in coronary atherosclerosis, there will be abnormal accumulation or abnormal fat deposition or lipid deposition, that is called as atheroma or plaque deposition. So because of the deposition of atheroma or plaque in the blood vessel lumen, I have showed you in the initial slides, what will happen? There will be narrowing. Okay, narrowing is nothing but a obstruction. Finally, what will happen? Because of the narrowing, there is decreased blood flow to the myocardium. That means what? Decreased oxygen to the myocardium. Okay. So always remember, CAD is one of the major blood vessel disorder, and the term atherosclerosis. Please remember the spelling of this, because one more term will come, that is arteriosclerosis. Okay. Now atherosclerosis is actually taken from a Greek word atheris, which means fatty mush, and sclerus, which means hard. Okay, so atherosclerosis or coronary artery disease is also called as ischemic heart disease. Okay, now atherosclerosis, as I told, is nothing but deposition of fat or lipid or plaque in the blood vessel, and because of that, what will happen? There will be blockage or narrowing. Now, one more term is there, that is arteriosclerosis. This is atherosclerosis, which means a CAD. Arteriosclerosis is occurring because of atherosclerosis itself. Here there will be thickening and hardening of the artery, where there will be loss of elasticity. Okay, both atherosclerosis and arteriosclerosis will take very long time to develop. Okay, remember, in atherosclerosis there is fat or lipid accumulation, while arteriosclerosis means there will be thickening and hardening of the artery, where the artery will lose the elasticity. Okay, so this is what I wanted to explain. Okay, atherosclerosis and arteriosclerosis. Atherosclerosis also refers to CAD, which I am taking right now. Okay, arterio means hardening of the blood vessel. So this is just the picture of the normal coronary artery. This is what happens in atherosclerosis, that is atheroma or fat deposition or plaque deposition. Here you can see yellowish, no? That is a atheroma or plaque deposition in the blood vessel. So that will narrow or obstruct the blood flow. Sometimes what will happen, further atherosclerosis, that fat deposition or the lipid deposition which is there can be dislodged. That time it will cause blood clot, and that time it may decrease the blood flow to any part of the heart. Okay, that is more dangerous actually. And sometimes what happens is, because of the obstruction of the blood clot, or because of the obstruction of this atheroma or plaque, it can not only affect your heart, it can also affect your brain. Okay, it can also dislodge in the cerebral arteries and can result in cerebrovascular accident or stroke. Okay, that is just I wanted to tell here. Now, definition of ischemic heart disease. I told all are the same, but the definition is slightly different. Okay, all the conditions are the same, but definition is slightly different. So remember the term ischemia here. Ischemia means what? Decreased blood supply, isn't it? So ischemia is also called as CAD, coronary artery disease, or coronary atherosclerosis. And here what happens is, there is imbalance in the myocardial oxygen supply and demand. Okay, myocardium is not getting enough oxygen. Even though the demand is more, the supply of the oxygen is lesser, so there will be imbalance between the supply and the demand. Okay, the definition of IHD is, it is a cardiac condition which results in insufficient blood supply or oxygen supply to the heart. That's all. Okay, so that is the definition of IHD. Ischemic heart disease is a cardiac condition which results in insufficient blood and oxygen supply to the heart. Next, we will see the etiologies and risk factors. Now, we have studied some common risk factors in hypertension, isn't it? Same risk factors will come here also. Okay, so remember, almost all the cardiac disorders are having modifiable and non-modifiable risk factors. Okay, please don't forget it. So we know already what is modifiable and non-modifiable risk factor, isn't it? Modifiable risk factors are those which is because of the lifestyle or because of the habit of the individual, and it can be modified. If you lead a healthy lifestyle, you can stop those risk factors. Okay, now we have also got non-modifiable risk factors which we cannot change, like your age, family history and genetics, isn't it? Now we will see in detail regarding the risk factors. Non-modifiable, which cannot be changed, are age, gender, family history, genetics. Modifiable risk factors which are occurring because of the lifestyle. We are dealing regarding each one of it in detail. Okay, like increase in the lipid levels in your blood. Most of the time, when excess of cholesterol is deposited in the blood, we call it as hyperlipidemia. that will result in coronary artery disease. Excess increased intake of fat or even excess increase of salt, if you have history of hypertension, obesity, that already we have seen, isn't it? Then diabetes mellitus, those who are smoking cigarettes or chewing tobacco and products, taking lot of caffeine, okay, alcoholism, excess alcohol intake, people who are on oral contraceptives, those who lead a sedentary lifestyle, obese people, type A personality, that I will deal later. Then excess of stress or strong emotions and increased homocysteine levels. So these are all modifiable risk factors. Okay. Now we will see regarding each one of it. Age, it is seen that as age advances, the risk of atherosclerosis or the risk of developing CAD also increases. Usually CAD is very less common among people less than 40 years, but nowadays we hear lot of incidents where young people, even young men like 40 years, 35 years people have got heart attacks and have developed coronary artery disease, isn't it? Okay. Next, moving on to gender. Now, when we have compared both males and females, it is seen that up till the age of 55 years, males are more having more incidence of CAD. Okay, and women it is less because we know we have got estrogen hormone which actually protects the women here, but after menopause what happens, that estrogen hormone will be reduced in the blood. Okay, and after that what happens is both men and women will have equal risk to develop any heart problem. Okay, so remember that after menopause the woman is at increased risk of developing any of the cardiovascular disorders, not only CAD. Next one is family history. Now, if there is a strong family history or genetic predisposition towards CAD or any cardiac problem, you can get. Okay. Next is modifiable risk factors. So as I told, excess consumption of fats or oils in the diet or trans fat in the diet. We know that animal fat or saturated fat, for example, butter, ghee, then consuming more animal fat like your beef, egg yolk, whole milk products, all this can be harmful. Okay, and we know that we have got two type of lipoproteins, isn't it? Low density lipoprotein and high density lipoprotein. Okay, now HDL has a protective action on the heart. Okay, while LDL is having ill effect on the heart. HDL is considered to be good cholesterol and LDL is considered to be a bad cholesterol. If at all in your body more and more LDL is getting developed or concentrated, when you check the lipid profile, when the LDL is more, then you are at risk of developing coronary atherosclerosis or IHD. Remember that. Okay, and HDL levels tend to protect the person, that is good cholesterol, it tends to protect the person, and HDL is more found in the vegetables or vegetable oil and all. Okay, next is hypertension. We know that a person with hypertension who is having increased blood pressure, the risk of developing any cardiac condition is very very high. Okay, so those who have got hypertension, the risk of developing coronary artery disease is also increased because most of the time the person with hypertension may be having some other habits like in excess salt consumption, excessive alcoholism, stress, smoking. So all these risk factors together along with hypertension can increase the incidence of coronary artery disease. Next one is obesity. We already have learnt obesity or fat accumulation around your waist or abdomen will increase your risk for hypertension, diabetes and even coronary atherosclerosis. Next is cigarette smoking. We know already cigarette smokes are having lot of chemicals in that. Carcinogens are there. There is nicotine present in it, isn't it? So the nicotine, it damages the blood vessels. It may also cause vasoconstriction. Okay, and this nicotine is told to increase the LDL consumption and it reduces the good cholesterol. Okay, that is your HDL. And it is seen that people who are taking lot of cigarettes, okay, those who smoke cigarettes a lot, or women who are on this oral contraceptives, they are at increased risk of coronary atherosclerosis. Okay, and the risk of getting heart attacks is also more. Next is diabetes mellitus. What happens when you are having hyperglycemia? Hyperglycemia is a condition in which there is increased blood sugar levels. Okay, so when more and more blood sugar levels increase in your blood, and along with that, you can be at increased incidence for atherosclerosis or even MI. Next is sedentary lifestyle. We know what is sedentary lifestyle, that is lack of physical activity. Now, lack of physical activity, when there is lack of physical activity, most of the time what happens, there is increased incidence of coronary artery disease. Okay, so what we can do is we have to practice a physical activity. Good exercises are very much important. It could be your brisk walking, cycling, swimming, all that can be performed. Okay, and most of the time it is seen that people who are more living a sedentary lifestyle, who do not have any sort of exercise in their daily life, okay, such people develop sudden death. Okay, sudden cardiac death is very very common in those individuals, isn't it? Nowadays we know that we have got good transportation facilities, we have got good technology, we spend our leisure activities sitting, isn't it, instead of working or instead of physical exercise. So that is really not good for our heart. Okay, next, type A personality. So this is what I was going to explain to you. This might be a little a new concept, isn't it? We have got different personalities. I am not dealing with all the personalities. Only I am going to tell about type A personality here. Okay. So type A personality people, they are more sort of stress prone. Okay, they are always in a hurry, they are very impatient, they are very fast and want to do all the things on time. Okay, it is told that type A personality people are always like urgent, with hostility, aggression, ambition. They are very ambitious, they are very competitive and very frustrated. They want to do their work on time, they will do it very fast. Okay, those are type A personalities. Okay, so these type A personality people, because of their nature of the body itself, they can be having like they are at risk, I'm telling. Okay, they will become at risk of like developing hyperlipidemia, excess of cholesterol in the blood, or even increased platelet aggregation. Okay, that also. And there is high cortisol and epinephrine in them because they are full time stressed. Okay, while this type B personality people, they are quite relaxed. Okay, full time, they are very easygoing and they don't have any time urgency. They try to be very cool. Okay, I'm not telling that in this type A personality people are very bad. No, type A personality people are, they want to do the things on time and they are very competitive. Okay, so their nature itself is making them high risk for coronary artery disease. Okay, while compared to type B people, that does not mean that type A people will end up with coronary artery disease or will surely get heart attack. It's just a risk factor. Okay, next one is psychosocial tension. We already know that lot of stress. It could be stress at your workplace, stress at the house. Okay, stress here does not mean not only tension. It could be lot of anxiety, fear, depression, or if you have got lot of infections, chronic diseases. Okay, or extreme temperatures, very cold or very hot temperature, then excessive noise around the environment, irritability, or lack of sleep, all this will result in stress. Okay, and when you face stress at your house also and even at your workplace, the risk of developing coronary artery disease, the risk of getting immediate heart attack also will increase. Okay, next is oral contraceptives. Now, the oral contraceptives are told to like it will increase your blood pressure, one thing. Okay, and next is they will disturb the blood clotting. We know if platelets are aggregating more, the risk of what we call as heart attacks also will increase. Okay, so clots will become more, means the clots will be circulated more in the blood and that can cause MI. Okay, and along with that, people who are on oral contraceptives, they tend to gain weight, lot of weight, and it can also result in increased blood sugars. Okay, so oral contraceptive pills, those who take, may be at risk of CAD. Not all the women, few of them tend to have CAD. Next is elevated homocysteine levels. Now homocysteine is a amino acid. Okay, it is a protein or an amino acid that is produced by the body, especially when we consume lot of protein products, animal fats and all, more and more homocysteine levels will increase. Okay, so if your homocysteine levels is very high, the risk of developing CAD also will increase. Okay, so that is what one of the important new things you have to remember here. High homocysteine levels are there in the blood, the risk of CAD also will increase. But the food items which is having folic acid, if you consume that, it is seen that it will reduce the homocysteine level. Okay, so we already know about the normal layers of the heart that you have already studied in anatomy, isn't it? Tunica intima, tunica media and tunica adventitia. Next we will see regarding the progression of atherosclerosis. Okay, how atherosclerosis is progressing. Okay, please remember there is a spelling mistake over here. Okay, that is atherosclerosis. So in atherosclerosis, there are mainly three stages. Okay, we'll see all the three stages here. So first stage is fatty streak, second one is fibrous plaque, and third one is complicated lesion. Okay, please remember the stages of CAD, coronary atherosclerosis. It is asked for 5 marks. Okay, it's very easy. You will have to draw the diagram also. Okay, so CAD, first stage is what? Fatty streak. We'll see what is fatty streak. Now, fatty streak is the earliest lesion of atherosclerosis. Okay, it is the earliest stage, and in this stage what happens is it is characterized by lipid filled smooth muscle cells. Okay, so lipid filled smooth muscle cells will be formed, and because of that it gives a yellow tinge, yellow color. Okay, and most of the time fatty streaks will start to develop by the age of 15. Okay, by the age of 15 usually they start to develop. Okay, so these are the earliest lesions, and usually it is characterized by yellowish tinge because of the lipid filled smooth muscle cells. The second stage is a fibrous plaque. Okay, fibrous plaque. So fibrous plaque is the beginning of the progressive changes in the endothelium. We know endothelium is an arterial wall, isn't it? And what happens is in this fibrous plaque, it starts with some changes in the endothelium. Okay, and usually the fibrous plaque formation will start by the age of 30. Okay, by the age of 30 this stage starts, and it will slowly go on increasing. Okay, and normally what happens is in a normal person, the endothelium which is getting damaged, it will be repaired immediately. But with the person with CAD, what will happen? The endothelium will not be replaced. Okay, it will not be able to rapidly replace. Okay, and next what happens is because of that nature, whenever there is endothelial injury, when there is endothelial injury, what will happen? The lipoproteins will start to transport cholesterol and other lipids. Okay, and because of that the fatty streak will be converted into collagen forming fibrous plaque. Okay, the first stage fatty streak is converted to a fibrous plaque which is having collagen, and because of that it gives a different color, that is gray or whitish color. And this plaque or fat or atheroma develops in one portion. Okay, it starts to develop in one portion. Suppose this is the lining, in this portion one side it will start to develop, and slowly it will start to cover up in a circular manner, and it may also block the entire lumen. So if this is the blood vessel, it starts to deposit in one corner and slowly it will increase, so it may even block the entire blood vessel. Okay, and what happens when there is obstruction? It will narrow the blood vessel, it will narrow the blood flow. Okay, so I'll just repeat the second stage, that is a fibrous plaque. It is a stage where there is progressive change. Okay, progressive change happens in the endothelium here. It starts by the age of 30 and increases. So In normal person, what happens is, if endothelium is damaged, normal it will replace fast. But in a person with the coronary artery disease or coronary atherosclerosis, it is not replaced rapidly. Okay. So what happens when there is any endothelial injury? The lipoproteins will start to transport the cholesterol and other lipoproteins. Okay. So what happens? The fatty streaks is converted into the fibrous plaque. Okay, where the collagen will start to form, and that will give a gray or whitish appearance. It will start to form on one portion of the blood vessel, and slowly it will increase. Okay, it actually deposits in a circular fashion. It can block the entire blood vessel also, but normally it may be there in halfway. So because of that, what will happen? It will narrow the blood vessel and it will reduce the blood flow. The last stage is complicated lesion. Now that is a final stage of atherosclerotic lesion or atheroma formation. It is very dangerous. Why it is dangerous? Sometimes it can be stable, sometimes it can be unstable. Okay, I'll tell what is that. In case of this fibrous plaque, when it continuously grows and when there is inflammation in it, chances are there that that plaque or atheroma which is there, it can become ulcerated and it will rupture. Okay, the plaque or atheroma which has deposited in the blood vessel, that can ulcerate and rupture. What will happen if it is ruptured? That blood clot which is there will be released into the bloodstream. That blood clot is called as a thrombus. Okay, so what will happen if the blood clot is released into the blood circulation? It can dislodge, or it can go and block any of the blood vessel, and it can obstruct the blood flow. Okay, and what happens is, in that region more and more platelets will also accumulate. So platelet aggregation also will increase in that region where there is atheroma. That will become very dangerous. Okay, so complicated lesion is a very dangerous stage. It is a final stage where there can be more and more platelet accumulation in large number over that area of atheroma, and along with that, the atheroma or the this what we call as a fat deposition, it can rupture and it can ulcerate. Okay, and it may obstruct the blood flow, that is by the formation of a blood clot or a thrombus, and that thrombus narrows the blood flow. Okay, and it can also totally occlude the artery. We know what will happen if the blood vessel will be occluded completely, no oxygenation, isn't it? So it can affect not only the heart but also your brain or any other body part. Okay, so this is the figure. You can draw this figure, and you can mark few things. Okay, not all the things. In stage 1, fatty streak may be what is important over here, migration of smooth muscle into the intima. You can mark the lipid accumulation, platelets and all. In the fibrous plaque, what is important? Collagen cap, you should not forget. Okay, and even the fibroblast. Okay, next, in complicated lesion, you have to draw the thrombus. Okay, thrombus can be drawn. This is not required. Next, this is just the pathophysiology in the form of a flow chart. Okay, you can either write the stages, and if you write this pathophysiology also, you have to explain all the three stages. Okay, due to etiological causes, what will happen? The cholesterol will be deposited, lipids will increase in the blood, and it will start to deposit in the layer of the artery. So first stage, what it results is fatty streak formation. It will proliferate and it will result in fibrous plaque, and last is the complicated lesion. Next is the clinical manifestations. Now, clinical manifestations of coronary artery disease or coronary atherosclerosis. So first of all, I told, in the coronary arteries, what will happen? There is deposition of what? This atheroma or plaque, isn't it? So the atheroma or plaque is deposited in the blood vessel, so that will obstruct the blood flow. Okay, so continuous obstruction to the blood flow, if there is complete obstruction, it may result in ischemia, that is decreased blood flow to any of the body part. Okay, so because of the ischemia, lot of clinical manifestations are seen. First of all, what happens is, we'll see the heart. Okay, in heart what and all happens, I will tell you in the cardiac. Okay, so in the cardiac system, because of the decreased oxygenation, decreased blood flow, there will be chest pain. It can be similar to that of angina. Okay, so chest pain will be there. And what will happen to the cardiac output? Is it normal? No, isn't it? It is reduced. So decreased cardiac output is there. And along with that, the person's ECG changes may also be seen. Okay, and cardiac enzymes may become increased. Along with that, there can be abnormal heart rate and heart rhythm, that is called arrhythmias. Okay, and along with that, the person can have angina pectoris. Angina pectoris means actually chest pain. Okay, we'll come to the topic next unit, that is angina pectoris. Sometimes it can also result in myocardial infarction, that is heart attack. I already told how heart attack occurs. The atheroma or the plaque which was there, it will be dislodged as a blood clot. That thrombus will occlude any of the coronary artery and it will cause ischemia of any heart part, okay, part of the heart muscle. So that will result in MI or heart attack. Other than that, it may also reduce the pumping of the heart, that is called heart failure or congestive cardiac failure. And other than that, it is also seen that such individuals have a risk of cardiac arrest or sudden cardiac death. Okay, and if it is dislodged in the brain, if there is obstruction of the thrombus in the brain, I told already what is the condition, stroke or CVA. Okay, then if there is obstruction to any of the peripheral extremity, it can cause paresthesia, that is numbness, tingling sensation, weakness of the body and excessive fatigue. Now, decreased oxygen to the lungs. What will happen when there is decreased oxygen to the lungs? Usually person will have dyspnea, that is breathing difficulty. Along with that, the patient can also have shortness of breath, okay, and orthopnea. Okay, and along with that, what happens is they may develop with the sweating, cold and clammy extremities. Okay, now that is because that is related to the skin. Because of decreased perfusion, the skin will be sweating a lot, and along with that, when to touch it is cold and very very clammy. Okay, so this is what I was telling. Angina pectoris means usually there will be angina like pain. Okay, usually around the chest region, retrosternum pain will be there. It can also radiate towards your jaw and even to the left side or sometimes even to the right side. It may be also present in the epigastric region. You'll study in detail in the next chapter. Next is diagnostic procedures. How to diagnose coronary atherosclerosis. Now, coronary atherosclerosis is nothing but a plaque deposition, isn't it? Atheroma deposition. So, to diagnose that, most of the time we will perform a echocardiogram. Okay, echocardiogram is a ultrasound of the heart, isn't it? Or it helps to record the mechanical activity of the heart. Already I have explained in detail about echocardiogram. Then ECG can be done to see if there is any changes in the heart rate or heart rhythm. Okay, ECG electrocardiogram can be done. Then to know the person's how he acts towards the activity, whether he is able to perform activity, we can perform stress test. Chest X-ray also can be done. Okay, along with that, computerized tomography, magnetic resonance imaging can be done. Okay, and remember to collect thorough history from the patient and also do a thorough cardiac examination. Okay, then one of the best methods to diagnose where is the exact blockage or where is the narrowing in the coronary artery, we always have to perform cardiac catheterization, which is called as cardiac angiography. I have already taken in detail, isn't it? So coronary angiography or cardiac catheterization, you know what they are doing in that. A catheter is inserted through the either through the radial artery, femoral artery, isn't it, or through the brachial artery, and once it reaches the heart, a dye will be injected and then you can visualize the coronary arteries and the obstructions. Next is blood investigations can be performed like complete blood count. You can also do cardiac enzymes, especially if they had a heart attack recently. Then lipid profile, you how to find out the cholesterol level in the patient. So a fasting lipid profile is a must. Okay, and we also have to find out HDL level, LDL levels. Next is lipid liver function test can be done, LFT. Okay, Other than that, to see if there is any kidney damage, we can perform renal function test and also check the blood sugar levels, that is fasting blood sugar, random blood sugar and postprandial blood sugar. FBS is taken only in the early morning, okay, that is after fasting 12 midnight, and early morning they will do the FBS. RBS can be taken anytime randomly. PPBS means postprandial, that is 2 hours after eating the meal you can take the PPBS value. Next, moving on to the management. So we will move on to medical management. So now when I'm telling regarding the medical management, it is repeating. Please study the antihypertensives that I have given. Okay. So same drugs are being repeated. If you have not studied that, again and again I'm just repeating and it will be just going over the head. You will not be able to follow it. Okay, so please remember the classification as well as the example for each antihypertensives. So here most of the time if the cause is hypertension, only then you are giving antihypertensives, remember that. Okay, so lot of antihypertensives are there. I have not given all of them, only few are listed here: beta blockers, calcium channel blockers, vasodilators, diuretics, ACE inhibitors. Okay, along with that, we can also give antiplatelet drugs. Okay, now antiplatelet drugs are mainly given to prevent the platelets from clotting. Okay, for example, aspirin and clopidogrel. Next is anticoagulants. Both are almost the same action. Okay, anticoagulants will prevent the clotting. Okay, it will prevent the clots from growing. Examples are warfarin and heparin. Next, most importantly, we have to reduce the lipid levels in the blood. Okay, to reduce the lipid levels in the blood, we have to give some drugs called as cholesterol lowering agents. They are also called lipid lowering agents or statins. Okay, remember lipid lowering agents or statin. The term examples are only ending with statin: atorvastatin, lovastatin. Okay, next is bile acid sequestrants. These bile acid sequestrants are those drugs that will remove the cholesterol or removes the bad cholesterol, that is LDL. Okay, example is cholestyramine. Okay, please remember the name of the drugs. Next one is thrombolytic agents, which is also called as fibrinolytics. Now, if already there is a blood clot which is formed, what we have to do is we have to break down the clot. Lysis of the clot should be done. That is done by streptokinase and urokinase. Next is we can give certain other drugs like niacin and nicotinic acid. Now niacin and nicotinic acid is told to reduce the secretion of low density lipoprotein or very low density lipoprotein, that is the bad cholesterol. Okay, next is taking good fat, that is to increase your HDL levels you can take omega-3 fatty acids, and one more is to increase the soluble fibers in your food you can take physalim. Okay, this is the normal one which we also consume. We just put it in the water and it will increase in size. Okay, sometimes they are told to have lot of fiber content in it. Okay, along with that, tell the patient to consume excess intake of vitamin B3 also. Okay, so that is also very good. Along with that, vitamin D is also essential. Vitamin K is also essential. Please note down, I have not explained these. You need to explain and you also need to give the examples like what is beta blocker, examples, metoprolol, propranolol. Okay, like that only. Calcium channel blockers, amlodipine, nifedipine. Vasodilators we have got is nitroglycerin, sodium nitroprusside. Under diuretics we have got so many classifications. Most easiest one is the Lasix, isn't it? AC inhibitors example are captopril, enalapril. So remember the examples of these also.